Let's speak now to Dr. Mvuyisi Mzukwa, Chairperson of the South African Medical Association. Dr. Mzukwa, good to speak to you. Now, let's start off with your reaction on reading about this very, very unfortunate attack on these two nurses.
Good afternoon to you, Hugo, and your viewers, and thanks for inviting us to your program. As a South African Medical Association, we would first want to say we relay or express our sympathy to the nurses that were violated on the 10th, yesterday, at the clinic whilst they were on duty. But also, we know that healthcare workers, as you know, are at the forefront of providing these essential services, most of the time under difficult conditions. So issues of physical assaults, rape, and all the issues that we identify now are not only threatening, the health of the healthcare workers, but it threatens the service delivery as well. It compromises the quality of service delivery, especially to those provinces that are or communities that are entirely dependent on them.
I want to touch on the nurses and the state that they're in at the moment. Have you been able to speak to them, or at least to get some indication of how it is that they're doing? One can only imagine the trauma that they're going through, and also their colleagues at the clinic.
Well, we have not had an opportunity to interact with the nurses at the moment. Our team are on the ground, trying to secure that. But this is very critical for us, because the safety and security of healthcare workers must be a top priority for government in this country. As you can see, in recent months, concerns have been mounting, of attacks on, increasing attacks on healthcare workers, and especially when they are on duty. So this is really disturbing for us, because we know that they are the ones that are providing service, and they're at the forefront of these essential services. So when that happens, it really makes them hesitant to work night duties, but also it makes life difficult for communities, especially because if you listen to the story, that facility is the only facility that provides a 24-hour service, for the community. So you can imagine the impact that is going to have on those. And also, these are the for professionals, to leave the public sector, going to other areas of life. So it's very critical that government takes it as a top priority.
Now, Doc, you've talked about this being a trend, or this not being the first time that such attacks have happened to members of the health services industry. Now, what measures are currently in place to ensure the safety of health workers, and where are the gaps, do you think?
Well, the gaps are, in fact, the fact that we don't think that the security personnel are well trained. I think that their training is not well advanced, to be looking after healthcare workers, especially at night. Because most of the time you find that they are not armed. There's no advanced surveillance systems in place. And even the cameras that are on the facilities are broken cameras, some broken lights. It's dark, so people can hide behind the buildings. So, those are the issues that I think should be prioritized. But also, we need not forget that, times have changed. This thing that the public can just get in the hospital or public facilities willy-nilly, I think it must come to an end, because healthcare workers are at risk. So what we need to do is that everybody that goes into the hospital must be inspected. There must be a metal detector, to make sure that they access the hospital, but the healthcare workers are safe as well.
Is this a motion that you're likely to be pushing, that the responsible authorities immediately attend to it before, God forbid, there's another incident?
Well, since we started hearing of attacks on healthcare workers, we've been with government, trying to highlight these issues, because most of the time we find that, there are bushes around, there are broken fences, cameras are not working, there are broken lights and all these things. So we've been always saying to government, there are basic things that we need to do to protect healthcare workers. So we are still calling upon government to say, please attend to these issues, because at the end of the day, they will be have a negative impact on the delivery of services to the communities, but also the lives of healthcare workers are at risk if we look at this. So government must take a zero tolerance approach when it comes to the issue of crime in the healthcare facilities. I think it must not be tolerated. But on top of that, we need to have engagement, awareness campaigns that are out there in communities so that they understand the impact of attacks on healthcare workers.
Now, Doc, I'd like to look at this from a practical perspective. You know, every quarter the gender-based violence statistics are announced, and we read 12, 13,000 or thereabouts every quarter, right? So you over 100,000 women, girls, and children are attacked in similar instances. Are you convinced that government or the department has a capacity to actually deal with this?
Well, I don't think it is a government problem alone. I think there should be a collaboration, with other stakeholders, especially the law enforcement agency, but also, community-based organizations, to start educating the public around this issue of violence, especially against women and children. We've seen recent incidents, for example, in KwaZulu-Natal, where there have been killings, especially in the South Coast, of women, and people take videos and do all these things. So I do think that there should be that collaboration at every level of society, so that it does not become a government problem and everybody else is folding their arms. We should be hands on deck, all of us.
All right, I want to shift focus a little bit, Dr. Mzukwa, and talk about the 1,800 qualified doctors that remain unemployed. And I know that this is a very sore point for you.
It's highly disappointing, to say the least, that a minister in South Africa, that really does not apply his mind when it comes to the human resources in the country. Because how do you tell those professionals who are using taxpayers' money to go to private or to go to countries abroad? The same minister have been saying that the private sector is stealing skills from the public sector. Now that they've got an opportunity to populate those vacancies, now he comes up and says, no, they must go to private. They must go to to the international community. Why are we training such skilled young professionals, when we cannot use them? And the other thing, the lie that is out there, that young doctors don't want to go to the rural areas, is a fallacy. It's not there. Those doctors are standing ready. Some of them are protesting in the Eastern Cape, telling the Premier that they are available, they want to serve communities, especially in the rural provinces. But we've got this, people hiding around their thumbs and telling people that, no, doctors, they don't want to go to these areas. I think it must be corrected. But the last thing from my side is the fact that, we are told about the NHI, and people are excited that there's an NHI. There's this energetic minister. That thing is going to implement the NHI. But now he's got an opportunity to rectify the shortages on the side of the human resource. But that is not happening. I mean, we've got a shortage, 0.3 doctors to 1,000 patients. How are you going to deliver NHI under those circumstances?
I'd like to think that you've had a conversation, or will have a conversation with the minister in question. But it also brings to light the possibility that many of these 1,800 could be lost to other countries that are looking for qualified medical personnel.
You will know that doctors in South Africa are highly trained. They are wanted by the international community. When I go outside of the country, especially areas like Ireland, You will always be asked for emails. The people want to hire you for whatever. But what I'm saying is we are exposed enough, because other countries don't see TB, don't see violence, don't see all these things. We are highly trained. We've been exposed to every condition in life. So if you allow these doctors, to leave the country, especially the community, the population that is rising, but also the disease burden, that is rising, I don't think, we are going to cope with the health outcomes if we allow these energetic young professionals to leave this country and we train for other countries. It's a shame to the Minister of Health in South Africa to be doing that.